Intermittent fasting refers to eating patterns based around the principles of the consuming very little to no calories for varying time periods with a regular pattern. Patterns include alternate day fasting, a periodic fasting, and time restricted fasting. Time restricted feeding has been shown to reduce the body weight, decrease the fasting glucose, decrease the fasting insulin, and reduce the insulin resistance. Some patients are also able to reduce their doses of insulin and other anti-diabetic agents also. Those people are on good dietary approach when they are taking about 50 units of insulin. So even a 20 or 25 is sufficient. When they are taking the 4 or the 5 OHS, if the compliance about your diet and exercise is good, and obviously you can reduce 25 to 50% of the OHS also. So that is the beauty of the medical nutrition therapy. So you can reduce the doses of the OHS, existing OHS, and also you can reduce the existing insulin dosages.
What fasting you recommend, sir?
Intermittent
fasting?
No, intermittent fasting only. Maximum 8 hours to 10 hours or 12 hours or 16 hours. Intermittent fasting. Provided if you are overweight and obese. Suppose if the person is the underweight or the normal body weight, restricted calories is sufficient. So I always give a lot of credit to the restricted calorie diet rather than the fasting, intermittent fasting. Restricted calorie diet means when you are consuming 4 idlis a day, take only 2 or 3. You are taking the good amount of the lunch. So reduce the some amount of the rice, some amount of the oily food, some amount of the curds, etc. So this is how you have to do it. So finally, ultimately, we have to reduce the calories. Yes. My first preference is always restricted calorie diet rather than these things, fasting diets or keto diets, etc. I don't prescribe any intermittent fasting or keto diets to my patients. I always go for take normal food, whatever you like, take it, but restrict it. So reduce it, reduce the quantity, and have an eye over the quality food. Quality food means no trans fats, no saturated fats, more fiber. That is quality food. So keto diet and paleo diet, it is a low carbohydrate eating pattern that derives 85% of the daily calories from the fat, 15 to 20% from the protein, and less than 5% from the carbohydrates. So the problem with the keto diets are elevated lipids. So the triglycerides will be 2000, or your total cholesterol will be 400, 500. So those people with a strong family history of ischemic heart disease, so there are always a chances of having renal failure or heart failures, etc. with these keto diets. So don't advise the keto diets for all the population. The paleo diet places no limits on macronutrients, but eliminates all processed foods in favor of the whole foods. Both these patterns shown to be useful in promoting the weight loss and in improving the diabetes control. However, long-term safety as well as the compliance are the major. This is very, very important. So whatever the diet you prescribe it should be a long-lasting, and the consistency, and then assurance, and accountability, and acceptance. So these are very, very important. So the best acceptable diet is you take whatever you like it, but reduce the quantity. So the restricted calorie diet plays a major role as far the compliance is concerned rather than your keto diet and paleo diets. A lot of a lot of the population who are on keto diet, who are on intermittent fasting, maybe 3 months, maybe 6 months, maybe 9 months, not more than a 1 year. But this diabetes is a lifelong disease. So it's not possible to maintain the same diet for a longer period. So what is possible is restricted calorie diet is possible. So you always aim for the restricted calorie diet rather than these diets. But these are the good when the fellow is overweight, when the fellow is obese, moribundly obese, about 120 kgs, 130 kgs. Yes, keto diet is good, intermittent fasting is good, paleo diet is good for about 6 months or 1 year or 1.5 months. After that, restrict the calorie diet. Still, modifying the macronutrient composition of the diet can alter the natural history of the diabetes. Ideal meal composition. See the carbohydrates, nearly 50%. Proteins, maybe 15 to 20%. Fat, maybe around 25%. To stop the diabetes from the processing, so these are the fats, carbs, proteins, and the fats. So reduction in the carbohydrate intake and increase in the protein intake can help reduce the incidence of the diabetes, prevent the progression of the pre-diabetes to the diabetes, and lead to the remission of newly diagnosed diabetes among the Asian Indians. So another case, you please concentrate on the cases A male 45-year-old businessman had diabetes for the 12 years. Say a typical Indian, 45 years, already 12 years. So he got the diabetes at the age of 33 years. His latest HbA1c is 8.9, so nearly 9%, poor control. He's on twice daily premixed insulin. Already he's on insulin, Mixtard, and metformin. So he's in the habit of consuming 120 ml of whiskey every evening. So what advice will you give him regarding the alcohol? See, the fellow, just 45 years old, a businessman. So very common in those people because out of stations they don't take the dinners. So friend circle, social gathering. So it's all common. But 120 ml of whiskey every day is always bad because in the presence of the uncontrolled. Okay, 60 to 90 ml is ideal, but with a pure control of the diabetes. But here on one hand the HbA1c is 9%, on the other hand he is consuming the alcohol. So that means more and more fatty liver, more and more chances of pancreatitis, more and more chances of some gastritis. So all the ill effects of the alcoholism. So alcohol will increases your Alzheimer's, your Parkinson's, okay, your gastritis, your pancreatitis, your GERD. So all these problems will be there. So alcohol can increase the susceptibility to the hypoglycemia because alcohol makes the liver not to work properly. So what will happen? It numbs the liver. So obviously when the fellow is in hypoglycemia, so what will happen in the liver? There will be glycogenolysis and neoglucogenesis. So both glycogenolysis and neoglucogenesis will be reduced or inhibited in the presence of alcoholism. So obviously the people will present with hypoglycemia. So there are some people who consume more alcohol and they get lot of hypoglycemias. So they reduce the neoglucogenesis and hepatic glucose output, that is glycogenolysis. They potentiate the hypoglycemia due to the insulin and sulfonylureas. Increase the risk of lactic acidosis with the bigonides. Suppose if the fellow is taking the bigonides like metformin, so the chances of lactic acidosis and metabolic acidosis is very high. In moderate amounts of not more than the 60 ml per day, no impact on the blood glucose or insulin levels with the usual food intake. See, some people, they are very good people. They advise, they follow the doctor's advice. I have few people, they consume just 60 ml only. They will have that measurement of the 60 ml and 30 ml. So they take only 60 ml. Very, very top people, very rich people, very affordable people. So they can take any amount of the alcohol per day. That is not the big issue for them. But they respect the doctor's advice. So that is good for them. See, otherwise, lot of the people, especially the young generation, say they don't listen our words and they consume very high amount of the alcohol. So they may cause hypoglycemia, food is delayed, and sometimes they take more alcohol and less munching. So that is again makes them to go for the more hypoglycemia. And some people, along with the alcohol, they consume a lot of non-vegetarian. So chicken 65 and then the France fry, etc., etc. So they also consume a lot of oil. So they lot of the saturated fats, lot of the trans fats. So again, yeah. So these are all bad for the diet. So again, on one hand, it causes a lot of lipids elevation. On the other hand, they also cause this damage to the liver. So appears to have a U-shaped or the J-shaped relationship with the blood pressure. So earlier days, when they consume the alcohol, that relieves the stress and the strain, and the blood pressure may come down to the normal. But in due course, as the alcohol amount is increasing, and that causes a lot of the stress and the strain, and again the blood pressure will go up. It adds empty calories. So therefore, an individual with the diabetes should avoid alcohol as far as possible. So the first advice is abstinence of the alcohol, and the second advice is if they are the chronic alcohols, they listen your words. So definitely you can restrict it to about 60 ml to 90 ml a day. In conclusion, dietary management is not just a diet prescription alone. So it is a therapy, a medical nutrition therapy. So it's a personalized diet plan. So individualized diet plan to suit the lifestyle of the particular person rather than demanding a change in the lifestyle to suit the diet plan. Okay. Newer trends and concepts like glycemic index, glycemic load need to be incorporated in comprehensive management of the diabetes. Successful dietary therapy is a team effort. So definitely not only the diabetic person, the whole family members also plays a major role, and also his friend circle that also plays a major role. 1.5 for your patient.